Hispanic with white patches.
Today, we're diving into a skin condition that many people may have seen or heard of, but know little about: vitiligo. Vitiligo can affect anyone, regardless of age, race, or gender, and it presents itself as patches of depigmented skin that stand out visually. In this video, we're going to break down what vitiligo is, what causes it, the signs and symptoms to look for, how it's diagnosed, and the treatment options available today. Whether you're here for yourself or someone you know, this information is valuable for understanding and supporting those living with vitiligo. Let's get started. What is vitiligo? Vitiligo is a chronic skin condition where the cells that produce skin pigment, known as melanocytes, are destroyed. This results in white patches of skin that can appear anywhere on the body, including the face, arms, legs, and even inside the mouth. Vitiligo is not contagious or life-threatening, but it can have significant emotional and social impacts due to its visible appearance. Although not everyone experiences additional symptoms, some may feel itching or a mild sensitivity in the affected areas. Causes of vitiligo. While the exact cause of vitiligo remains unclear, research suggests several potential triggers and factors. Number 1. Autoimmune factors. Vitiligo is often considered an autoimmune disorder where the immune system mistakenly attacks and destroys the melanocytes, or pigment-producing cells, in the skin. In this case, the immune system's response is thought to target and destroy these cells, leading to depigmentation. People with other autoimmune conditions, such as thyroid disease or diabetes, may have a higher likelihood of developing vitiligo. Number 2. Genetic predisposition. Genetics can play a role, as individuals with a family history of vitiligo are more likely to develop it. Studies show that around 20 to 30% of people with vitiligo have a family member with the condition. Specific genes, such as NLRP1 and PTPN22, have been linked to a higher risk of vitiligo. Number 3. Environmental triggers. Environmental factors, including stress, sunburn, or exposure to harmful chemicals, may trigger vitiligo in those genetically predisposed. These factors might cause or accelerate the immune system's attack on melanocytes, leading to faster progression of depigmentation. Number 4. Oxidative stress. Oxidative stress occurs when there's an imbalance of free radicals and antioxidants in the body, potentially damaging cells. Research suggests that oxidative stress may play a role in the destruction of melanocytes in people with vitiligo. However, it's unclear whether this is a cause or a consequence of the disease. And finally, number 5. Neurogenic factors. Some theories propose that nerve cells in the skin might release toxic substances that damage melanocytes. This theory is still under investigation, but it could explain why vitiligo sometimes appears in specific patterns on the skin. Let's go to the next step: signs and symptoms of vitiligo. Vitiligo is primarily identified by the presence of white or depigmented patches on the skin, but there are several distinct features and patterns. Number 1. Loss of skin color. Depigmentation. The most noticeable sign is the appearance of white patches of skin, which can begin as a small area and gradually spread. Depigmentation usually starts on areas exposed to the sun, such as hands, feet, arms, and face. 2. Symmetrical patterns. Often, vitiligo appears in a symmetric pattern, known as non-segmental vitiligo, on both sides of the body. Commonly affected areas include the hands, arms, knees, elbows, and around bodily openings like the mouth, eyes, and genitals. 3. Segmental pattern. In some cases, segmental vitiligo, depigmentation occurs on only one side of the body, following the path of specific nerves. Segmental vitiligo often appears earlier in life and tends to progress more rapidly but then stabilizes. 4. Premature hair whitening. In areas affected by vitiligo, hair may also lose its pigment, turning white or gray. This can affect body hair, eyelashes, eyebrows, and scalp hair. 5. Change in eye and inner mouth color. In rare cases, vitiligo may affect the color of the eyes or inner parts of the mouth, resulting in depigmentation in these areas. Diagnosis of vitiligo. Diagnosing vitiligo typically involves a physical examination and may include several diagnostic techniques. 1. Physical examination. A doctor will usually begin with a thorough physical examination of the skin and ask about the patient's medical history, family history of vitiligo, and any other autoimmune conditions. 2. Woods lamp examination. A Woods lamp, UV light, is often used to examine the skin more closely. Under UV light, vitiligo patches may appear brighter, helping doctors identify subtle areas of depigmentation. 3. Skin biopsy and blood tests. In some cases, a small skin biopsy may be performed to rule out other skin conditions. Blood tests may also be ordered to check for autoimmune diseases, such as thyroid disorders, which are sometimes associated with vitiligo. 4. Genetic testing. Although not commonly done, genetic testing may help identify specific risk factors, especially if there is a family history of vitiligo or other autoimmune conditions. Treatment options for vitiligo. There's no cure for vitiligo, but several treatments aim to restore skin color, control spread, and improve appearance. Treatment choice depends on the severity, location, and preferences of the individual. Number 1. Topical treatment. Topical corticosteroids and calcineurin inhibitors, e.g., tacrolimus, can help restore some pigmentation, especially in early-stage vitiligo or small patches. Number 2. Light therapy. Phototherapy. Narrowband UVB and BUV phototherapy is one of the most effective treatments for vitiligo. It stimulates melanocytes, helping to gradually repigment affected skin. Number 3. Excimer laser. This laser therapy is used for small, localized patches and focuses on depigmented areas, encouraging pigmentation without affecting surrounding skin. Number 4. Surgical options. In cases where vitiligo is stable and has not spread for over a year, skin grafting or cellular transplantation techniques can help restore pigment. I know you're getting tired till no. I'm gonna finish it. Pay more attention to the next one. Number 5. Depigmentation therapy. For individuals with extensive vitiligo who want a more uniform skin tone,